Access to high-quality primary care systems can improve health outcomes. However, primary care is often very poor in conflict and post-conflict countries. The impact of COVID-19 on already stressed healthcare systems can also be enormous.
And in Haiti, it's an even doubly compacted situation where we have the devastation of the earthquake, ongoing conflict issues, we have ongoing inequality and economic issues, and we recognize that all of that's put a lot of stress on the primary healthcare system. So Castelline, could you tell me a little bit about IET Analytics, your mission, and the work that you do?
So IET Analytics is a data lab headquartered in Haiti, and we're using technology to create economic opportunities for youth in Haiti. Recognizing the need to respond to the adverse effects of COVID-19 in Haiti, we developed the Haiti Health System Dashboard. It contains information on all health infrastructure in Haiti. The dashboard has two key functionalities. First, using geotag data, we created an interactive map. So this gives you an immediate visual representation of what health capacity looks like by geographic region in Haiti. Using the tool, you can filter by different administrative regions to see what the distribution of hospitals are, the distribution of health centers, and other key health sites. The purpose of the map is to help identify areas that are potentially vulnerable or susceptible to potentially devastating effects of COVID-19. The second functionality of the tool is our dashboard. The dashboard allows users to compare by geographic regions on a number of indicators like the number of full-time medical staff, the availability of laboratory services, the number of overnight and inpatient beds, and a host of other key health indicators you can see on the dashboard and compare, and see top-line estimates by regions as well. Haiti has two official languages, one of them being Haitian Creole, the most widely spoken of the two. And so the dashboard is fully translated into Haitian Creole, and it's also available in English for Haitians living in the diaspora and for a broader global public. So it's a dual language tool.
I know that any of these types of programs involve certain challenges.
The challenges were many, if I may say, the primary challenge being sourcing data. We stumbled on a national level survey that was administered by USAID in Haiti. It's called the Service Provision Assessment Survey, and it's conducted every 5 years. And it is the most comprehensive survey on health capacity. The process of sort of decoding the data dictionary took weeks. Trying to decipher what the documentation meant, and then cleaning the data and clustering and classifying the data to meet our specific analytical needs also took a number of weeks.
You've done a lot of work on releasing this, getting it out there, different ways it's being used. Could you talk a little bit about how this tool's been received by the community?
We've gotten such great reception from different actors in Haiti, from civil society agents to nonprofit actors to individual Haitians. They want to use the tool themselves. So we've gotten suggestions to include different features to make it user-friendly. We had one nonprofit organization reach out wanting to partner with us to build the second iteration of the tool that maps health services specifically for women and girls. So can a woman use the tool to see where the nearest birthing center is, to see what the distribution of maternal care services are like in Haiti. We've also gotten data science practitioners in Haiti to suggest alternate data sources. And one of them was the OpenStreetMap's Global Health Sites Mapping Project. So we're thinking about updating the tool to contain data collected from the OpenStreetMap. So I think the power of geotag data is that it allows you to see things visually that goes beyond the traditional tables or charts. And I think especially when we're looking at disparity or identifying areas that are vulnerable and underserved, a visual representation is a very powerful way to do that. So a number of users have walked away saying that they didn't know that healthcare services were so concentrated around the capital city. When you see the map, you can't deny that. And I think it can be a call to action to service the areas that are obviously underserved. Through this dashboard, we hope to inform Haitian citizens, the Haitian government, and the international aid community about health system access disparities across Haiti.
So using data in real time to determine where healthcare service capacities are underserved, to identify communities with the greatest vulnerabilities to COVID-19, and to target the distribution of essential resources by respective governments and the international aid community can make a positive difference when it comes to effective, rapid responses.